National Objectives for Health. Chapter 1, Philippine Health System at a Glance. So, health financing. There are four main sources of financing: the national and local government, insurance, user fees, and donors. National Health Insurance Program, or NHIP, managed by Philippine Health Insurance Corporation, institutionalized and signaled the movement towards a single-payer, premium-based financing or insurance system. However, the current system continues to maintain a dual financing system existing parallel to each other. So this figure shows the total health expenditure by source, Philippines in 1997 and 2007. So in health facilities, there are three: the government hospitals, private hospitals, and primary health care facilities. So hospital classification based on ownership: public hospitals and private hospitals. Both public and private hospitals can also be classified by the service capability. At present, Level 1 hospitals account for almost 56% of the total number of hospitals. The Department of Health 2009, Lavado 2010, which have very limited capacity and comparable only to infirmaries. So in this figure shows the number of hospitals by classification and ownership in the Philippines 2009. This figure shows that the private hospitals outnumbered the government hospitals in all categories. The disparity is more noticeable in tertiary hospitals, where the number of private hospitals is 4 times that of the government hospitals. So in this figure, it shows the distribution of hospitals by level. In level 1 and 2, hospitals are relatively well distributed across the country, though there are few provinces which limit level 2. However, hospitals with higher service capabilities are highly concentrated in Region 3 and National Capital Region. So in this figure, it shows a table number of beds and rate per 1,000 population by region in the Philippines 2008. So, main drivers of the healthcare system and are essential for the efficient management and operation of the public health system: health educators and providers of health services. So, in this figure, it shows the number of government health workers in Philippines 2008. So, 50% of the clients who sought medical advice or treatment consulted public health facilities, and 42% went to private health facilities, and almost 7% sought alternative or traditional health care. In rural health units and barangay health centers, 33% were the most visited health facilities in almost all the regions except for NCR and CAR. 36% of infants are still delivered by helots. People with PhilHealth insurance are more likely to be confined in a private hospital, 56%, than those without PhilHealth insurance, with 28%. So based on a survey by the Social Weather Station in 2006, majority of Filipinos, especially the low-income households, prefer to seek treatment in a government hospital if a family member needs confinement. So in health outcomes, life expectancy, the projected average life expectancy of Filipinos in 2005 to 2010 is 68.8 years. So in males, there are 66.11 years. In female, 71.64 years. It is projected that the average life expectancy of Filipinos will increase to 70.38 years from 2010 to 2015 and 71.59 years from 2015 to 2020.
So death and births. This figure shows the crude death rate, Philippines 2000 and 2010. Disease trends in the Philippines. Communicable disease. So this table shows the top 10 causes of morbidity in Philippines 2010. Non-communicable diseases. Around 75% of the total deaths can be attributed to NCDs, which is similar to the estimates in most developing countries. Around 5% of the population are now considered to be obese. 10% are diagnosed with hypercholesterolemia, and 24% are considered hypertensive. So achieving universal health care for all Filipinos. Background and rationale. Substantial gains in health sector. Social health insurance coverage and benefits, execution of Department of Health budgets, LGU spending in health, systematic health investment planning, capacities of government health facilities, implementation and monitoring of public health programs. DOH and PhilHealth recently conducted a joint benefit delivery review to increase enrollment coverage, improve availment of benefits, and increase support value. Benefit delivery for the sponsored program was found to be lowest among our people. Public hospitals and health facilities have also suffered neglect. The poorest of the population are the main users of government health facilities. To address these challenges, the Aquino Health Agenda is being launched. The Philippine health system will require the following components: enlightened leadership and good governance practices, accurate and timely information and feedback on performance, financing, competent workforce, accessible and effective medical products and technologies, appropriately delivered essential services. This order provides the objectives, strategic thrust, and implementation framework to implement the universal health care. So the second is scope and coverage, apply to the entire health sector, public and private sectors, the DOH bureaus, national centers, hospitals attached, external development partners. Also provide the also provide for the guidelines, approaches, and resources needed to affect and influence public-private partnership, benefit families, civil society, private and public, healthcare providers, and local government units. The third is the overall goal and objectives. The overall goal: universal healthcare shall be directed towards ensuring the achievement of the health system goals of better health outcomes, sustained health financing, and responsive health system. General objective: to improve, streamline, and scale up the reform strategies in HSRA and FI have equitable access to quality health care. Strengthen the National Health Insurance Program. Benefit Delivery Ratio, BDR, the catastrophic expenditures, case mix system, community health team, continuum of services, geographically isolated and disadvantaged, area, income quintiles, local health system monitoring and evaluation for efficiency and effectiveness, national household targeting system, no balance billing policy, public-private partnership, service delivery package, support value, universal healthcare. So the Aquino Health Agenda is a focused approach to health reform implementation. Financial risk protection through expansion in NHIP, enrollment and benefit delivery. Improve access to quality hospitals and healthcare facilities, attainment of the health-related MDGs. The six strategic instruments shall be optimized: the health financing, service delivery, policy, standards and regulation, governance for health, human resources for health, health information. The success of the AHA shall be measured by the progress made in preventing deaths, controlling diseases, improvements in access, increasing NHIP benefit delivery rate. The DOH shall facilitate the implementation of the AHA. DOH recognizes that LGUs have the primary mandate to finance and regulate local health systems, consistent with the presidential commitment of zero corruption in the government. Broad and sustained participation among all stakeholders shall be purposive, coordinative, harmonized, and productive. UHC shall be client-centered. DOH shall engage local health systems. Specific guidelines: financial risk protection through improvements in NHIP benefit delivery shall be achieved by redirecting PhilHealth operations, expanding enrollment of the poor in the NHIP, promoting the availment of quality outpatient and inpatient services, increasing the support value of health, a continuing study to determine the segments of the population to be covered for a specific range of services. Improved access to quality hospitals and other healthcare facilities shall be achieved by a target health facility enhancement program, provision of financial mechanisms drawing from public-private partnerships, fiscal autonomy and income retention schemes, unified and streamlined DOH licensure and PhilHealth accreditation, regional clustering and referral networks of health facilities based on their catchment areas. Health-related MDGs shall be attained by deploying community health teams, utilizing the life cycle approach in providing needed, aggressively promoting healthy lifestyle changes, ensuring public health measures, harnessing the strengths of interagency and intersectoral cooperation to health.
So, roles and responsibilities. DOH shall develop guidelines and protocols, institutionalize the PIPH, CIPH, and AOP as a process, utilize its resources for public health grants and commodities, engage partners in policy development and implementation of strategies, including the media, advocate with Congress, engage professional groups, the academy, NGOs, and other private sector, consolidate available resources and provide grants, operate DOH retained hospitals and facilities. PhilHealth shall expand NHIP coverage, secure financial risk protection for outpatient services, secure financial risk protection for inpatient services, improve management of the NHIP, seeking other financial instruments and strategies. So, roles and responsibilities. Local government units are encouraged and assisted to develop policies and plans appropriate to their locality and consistent with the implementation of the AHA. mobilize and utilize resources, allow their local hospitals and other public health facilities appropriate incentives, organize community health teams and service delivery networks in partnership with the private sector for effective delivery of health service packages, and whenever appropriate, contract private providers. So the development partners within the context of sector development approach for health and subject to agreements with the DOH shall provide official development assistance consistent with the national thrust and direction for health, align and harmonize their systems and processes with government procedures and institutional reform processes, cooperate in the establishment of, ensure the sustainability and institutionalization of assistance projects. So, DOH implementation arrangements. DOH offices shall be clustered according to the three major strategic thrust of UHC, especially in ensuring access to health by the poor, financial risk protection, attaining MDGs, health facilities enhancement. Strengthening of local health systems shall be facilitated and coordinated by the Centers for Health Development through the regional clusters. It shall assume the following functions: oversee operation and concerns of hospitals covering the same catchment, pool resources from the DOH Central Office, LGUs, field health, the private sector, and development partners. Decide on equitable allocation of, provide policy direction. The UHC implementation plan and operational guidelines shall be jointly formulated by the DOH and other stakeholders within 2 months after issuance of this AO. Progress of AHA implementation shall be monitored and evaluated quarterly. So, repealing clause. The provisions of previous orders and other related issuances inconsistent or contrary to the provisions of this administrative order are hereby revised, modified, repealed, or rescinded accordingly. Effectivity. This order shall take effect immediately.